A one woman's trip to the salon for a manicure that she says resulted in her developing a rare form of nail cancer. Stephanie Ramos was here with her story. Good morning, Stephanie.
Good morning, Robin. This mother of three said she went for a manicure, got a cut on her cuticle, and it didn't heal for months. She saw several doctors only to find out she had nail cancer.
It seemed harmless until it wasn't.
Grace Garcia got her nails done faithfully for more than 20 years. But in 2021, in what she says happened during a pre-Thanksgiving day of pampering, left her in complete shock.
As the technician was cutting my cuticle, she cut me. It was a deep cut, and I remember being very upset about it.
Garcia says after a few days, she thought the cut on her ring finger was healing, but still, something seemed off.
It felt as if I couldn't bump my finger into anything. I couldn't use it. I couldn't type well. It felt tender to the touch.
After dealing with the pain for months and multiple follow-ups with her general doctor, in April of 2022, she was referred to a UCLA health specialist and dermatologist, Dr. Teo Soleimani, for a biopsy.
It came back as a squamous cell carcinoma, which is a very common form of skin cancer. But interestingly, when she was referred to me and I saw her finger, she didn't have any of the traditional signs. Hers was HPV driven. And it's an interesting thing to see.
Human papillomavirus is commonly considered a sexually transmitted infection that can be transmitted through skin-to-skin contact or skin-to-mucosa contact. Depending on the strain, it can cause cancers or manifest as warts on various parts of the body. But in very rare cases, contaminated equipment has been considered a possible means of transmission for the disease.
Grace had a very obvious injury that allowed a portal of entry for the high-risk strain to kind of get in there. The reason we don't see it in places like, our hands or our face or anywhere where we have thick skin is generally our skin has a top layer that's pretty protective.
While HPV vaccination can prevent more than 90% of cancers caused by HPV from ever developing, prior to her diagnosis, Grace was not vaccinated.
I think everybody should be vaccinated because it's one of the few simple ways that we can reduce cancer.
Here's some really good news. Grace is now cancer-free. Now, it's important to note that the HPV vaccine is available for both men and women and can help prevent cancers like these from occurring in the first place. And when you go in for a manicure, make sure the tools being used are clean.